Erythema infectiosum is a common viral infection that affects primarily children aged between 5 and 15 years. It is caused by the human parvovirus B19, which is a small, single-stranded DNA virus. The condition is also known as fifth disease, because it was the fifth disease to be described in a classic series of childhood exanthems. The term slap cheek syndrome refers to the characteristic appearance of the rash on the face, which resembles a slap mark. Erythema infectiosum is a self-limited condition that usually resolves within 1 to 3 weeks, without any significant complications. In this video, we will explore Erythema infectiosum overview, meaning, causes, sign, symptoms, diagnosis, treatment, home remedies and frequently asked questions. By the way, welcome to our channel. Don't forget to thumb up and subscribe. What is the meaning of Erythema infectiosum, word by word? Erythema infectiosum is a medical term that describes a specific type of viral infection. Erythema refers to a redness of the skin, and infectiosum means infectious or contagious. So, the term Erythema infectiosum literally means a contagious infection that causes redness of the skin. It is also commonly known as fifth disease due to its classification as the fifth childhood illness that causes a rash. Causes of Erythema infectiosum. Erythema infectiosum is caused by the human parvovirus B19, which is a ubiquitous virus that infects humans worldwide. The virus is highly contagious and is transmitted from person to person via respiratory secretions or blood products. The virus can also be transmitted vertically from mother to fetus during pregnancy. Risk factors for Erythema infectiosum include close contact with infected individuals, living in crowded conditions, and attending daycare or school. In traditional Uyghur medicine, it is believed that the skin has a neutral temperament. Some skin conditions, such as Erythema infectiosum, are usually caused by an imbalance in the skin's temperament due to various internal and external factors. Signs and symptoms of Erythema infectiosum. The incubation period for Erythema infectiosum is usually 4 to 14 days, after which the prodromal symptoms may appear. The prodromal symptoms are nonspecific and include fever, headache, malaise, and upper respiratory symptoms. After the prodromal phase, the characteristic rash appears, which starts on the face as a bright red rash on the cheeks, resembling a slap mark. The rash then spreads to the limbs and trunk, where it assumes a lacy or reticulated appearance. The rash may be pruritic or painful, and may be accompanied by joint pain and swelling. In some cases, the rash may recur after exposure to sunlight or heat. Complications of Erythema infectiosum are rare, but may include anemia, arthritis, and hydrops fetalis in severely immunocompromised individuals or pregnant women. Diagnosis and treatment of Erythema infectiosum. Erythema infectiosum is usually diagnosed based on clinical features and history of exposure to infected individuals. Blood tests may be performed to detect the presence of parvovirus B19 antibodies, but these tests are not routinely necessary. Treatment for Erythema infectiosum is usually supportive, and may include acetaminophen or nonsteroidal anti-inflammatory drugs, NSAIDs, for pain and fever. Antiviral therapy is usually not necessary, except in severe cases or in immunocompromised individuals. Prevention and control of Erythema infectiosum. Prevention and control of Erythema infectiosum is mainly achieved through vaccination and hygiene measures. Vaccination against parvovirus B19 is available, but is not routinely recommended for healthy individuals. Isolation and quarantine measures may be necessary in outbreak situations, to prevent the spread of the virus. Good hand hygiene and respiratory etiquette are also important in preventing the spread of the virus. Erythema infectiosum in special populations. Erythema infectiosum may have special implications in certain populations, such as pregnant women and immunocompromised individuals. In pregnant women, infection with parvovirus B19 may cause fetal anemia, which may lead to hydrops fetalis or fetal death. Immunocompromised individuals, such as those with HIV, AIDS or undergoing chemotherapy, may develop severe and prolonged symptoms of erythema infectiosum, and may require hospitalization and antiviral therapy. Home remedies for erythema infectiosum. There are some home remedies that can help alleviate the symptoms of erythema infectiosum, although they are not a substitute for medical treatment. These include rest. Getting plenty of rest is important to help the body fight the infection. Staying hydrated. Drinking plenty of fluids can help prevent dehydration, which can be a complication of erythema infectiosum. Pain relief. Over-the-counter pain relievers such as acetaminophen or ibuprofen can help relieve fever and pain. Cool compresses. Applying cool compresses to the affected area can help relieve itching and discomfort. Vitamin C. Some studies suggest that vitamin C supplements may help boost the immune system and reduce the severity of symptoms. Frequently asked questions about erythema infectiosum. Is erythema infectiosum contagious? Yes, erythema infectiosum is highly contagious and can be spread through respiratory secretions or blood products. Can adults get erythema infectiosum? Yes, although erythema infectiosum is most common in children, adults can also get the infection. Is there a vaccine for erythema infectiosum? Yes, there is a vaccine for parvovirus B19, but it is not routinely recommended for healthy individuals. Erythema multiforme, Erythema nodosum, Erythema infectiosum, Erythema toxicum, and Erythema marginatum. Are there any differences between them? Erythema multiforme, Erythema nodosum, Erythema infectiosum, Erythema toxicum, and Erythema marginatum are all skin conditions that involve redness of the skin due to inflammation. The reason why they all have erythema in their names is that erythema is a medical term that refers to redness of the skin caused by inflammation. While these skin conditions share the feature of redness and inflammation, they have different causes and pathophysiologies. For example, erythema nodosum is a type of paniculitis that results from a delayed hypersensitivity reaction to various triggers, such as infections, medications, and autoimmune diseases. In contrast, erythema multiforme is a hypersensitivity reaction to certain medications or infections, such as herpes simplex virus or mycoplasma. Erythema marginatum is a skin rash that is associated with rheumatic fever, while erythema infectiosum is a viral infection caused by parvovirus B19. Erythema toxicum, on the other hand, is a common rash in newborns that is benign and self-limited. Therefore, these conditions have different pathophysiologies and causes, and should be diagnosed and treated properly by a healthcare provider. Thanks for watching. Take care and stay safe.